Hello, my name is Bernie McStay, and I'm an instructor at Sinclair Community College in the Health Information Management Department. Today, we're going to go ahead and discuss the skill of medical coding with an emphasis on coding in the ICD-10 CM classification system. After completing today's lesson, you're going to be able to define these following objectives. Define medical coding. Define ICD-10 CM and name the cooperating parties that determine the codes and guidelines. List the uses of the ICD-10 coding system. List the steps in coding. Code a medical scenario. How do we get all the information for medical coding? The medical record is the primary resource for all medical documentation. One major point to remember is that the medical record, whether it's from a physician's office or the hospital, it is a legal document of care provided to the individual patient. It is this documentation that is the source for all codes sent to insurance companies and third-party payers for proper reimbursement. The first rule of coding is if it was never documented, it was never done. Documentation for medical coding can be found in a variety of places, such as laboratory or radiology results, consultation letters or referrals, operative reports, and pathology reports. The most formative method to find your information for medical coding is found within the SOAP note. This is an example of a SOAP note and how it is actually documented by the physician. We can only code what is documented. A SOAP note is a form of documentation method that most healthcare providers use within a patient's chart. There are 4 parts to the SOAP note: S for subjective, O for objective, A for assessment, and P for plan. Under the subjective, this describes the patient's current condition in a narrative form. Basically, what comes from the patient's mouth, what they are saying and what they are feeling. Usually you can find out how long a disease has or signs and symptoms have been onset, the chronological order of how things actually happen, the severity, pain level, and any additional signs and symptoms that could be used. Any self-treatment could also be another source of information. The O stands for objective. Documentation for objective are what the physician can actually see as traceable facts. These would include such things as vital signs, palpitation for pain, laboratory results, and different measurements such as age and weight of the patient. The assessment, the physician's medical diagnosis. This is where we get a lot of our information from for the visit, for that individual encounter. Remember, we are only coding for the reason for visit for that encounter. P is for plan. This describes the healthcare provider will do to treat the patient, what tests are going to be ordered for the lab or x-ray, what procedures may have to be performed, and any medications that would have to be prescribed. Let's talk about what medical coding is and how you are able to use this in your everyday life. Medical coding is the assigning of a universal alphanumeric code to diagnosis and procedure descriptions. Coding is likened to a second language by some, and as a medical coder, you must understand the meaning of the medical documentation prior to code conversion. Coding professionals review clinical medical records and assign appropriate medical codes for a variety of reasons. Coding in the healthcare setting translates medical terminology into specific combinations of numbers and letters that are universally recognized and utilized by healthcare providers and payers in the United States. These codes represent each disease, condition, syndrome, sign, or symptom that a patient has had and are required by computerized databases, statistical, and reimbursement programs. The ICD-10 classification system became effective October 1st, 2015, and was mandated to be used in the United States. The clinical modification, CM, is from the ICD-10 of the World Health Organization. The ICD, the International Classification of Diseases, serves a variety of needs in the United States healthcare system, such as communication between physician offices and other healthcare providers, accurate reason for a patient's visit, measuring the safety, quality, and efficacy of medical care, and monitoring the utilization of healthcare resources to provide the best medical and quality of care possible. ICD-10 mandates a minimum of 68,000 codes that have increased in specificity with the increased number of codes. The structural makeup of an ICD-10-CM code ranges from 3 characters to 7 characters. The first digit is alpha. With the exception of the letter U, all other letters are used. The second, third digits are always numeric. The fourth, fifth, sixth, and seventh characters can be alpha or numeric. There is always a decimal point after 3 characters, and 3 characters is the minimum number that a code can be. The first 3 characters of an ICD-10-CM code are referenced as the category code. These usually match up to a body system. The 4th character references the etiology of the disease. The 5th character is the anatomic site, and the 6th character is the severity and your laterality. The 7th character is called an extension code, which is dealing with classifications of special injuries and external causes of injuries. How do we get codes in the United States? The formative book for all medical coding is the ICD-10-CM book published by the American Health Information Management Association, or AHIMA. This text is updated annually by cooperating parties such as the World Health Organization and the Centers for Disease Control. Other cooperating parties are the National Centers for Health Statistics, which compiles statistical information used to guide actions and policies to improve the public health of U.S. citizens, and CMS, or the Centers for Medicaid and Medicare Services. They develop the procedure portion of this textbook. As a medical coder, you are referenced as the subject matter expert when it comes to coding and medical documentation. You will find prior knowledge is necessary in both medical terminology and anatomy and physiology in order to be a successful coder. One thing new coders always seem to do is that they're going to be able to use their own experiences, either from themselves, a family member, or a friend, to code and to find out if they've been billed properly from prior accidents, injuries, or illnesses. To code each disease or condition completely and accurately, the coder should do the following basic steps when coding a medical documented record. First, identify all main terms that are located in the documentation. Refer to any subterms that are indented underneath the main term. Follow all instructions such as see and see also, and if you need further explanation within the index, to be as specific as possible. Verify the code selected in the tabular list. Read and be guided by all the instructional terms in the tabular list. This is the number one error that new coders make. You must read. Next, assign all codes to their highest level of specificity, up to a total of 7 characters if applicable. And then lastly, continue with the diagnostic statement until all elements are identified and coded. Let's take a look at this medical coding example. As you can see, it's in the standard SOAP note format, with the S being the subjective, where the husband is speaking for the wife, saying that she was cooking dinner and that she fell, and when he came to her, she was out cold. The next thing you find out, she suffers from continual headaches, and this is part of the documentation by the provider. The objective is then documented by the doctor on what he is able to see, and then you have your assessment. This is the important part of what is going to be done for medical coders. This is the diagnosis. As you can see, it's been diagnosed with persistent headaches from status post-concussion. a cervicalgia, and then a cervical somatic dysfunction. And then lastly was a plan on what he was going to do to treat her with physical therapy. The items that are highlighted show the specificity that coders have to become aware of. The assessment shows the ability of what has to be done with medical terminology to know what body system you're talking about, and then anatomy and physiology to know what cervical somatic dysfunction will play a part in coding also. So following the basic steps of ICD-10 CM coding, we locate the main term within the index. It is located in bold print and at the top of the page, concussion. We know with more specificity that the patient lost consciousness for approximately 2 minutes. If you follow that down with your subterms with, which is indented twice, loss of consciousness of 30 minutes or less, we have an identified code of S06.0X1. We then verify that code in the back of the book in the tabular index. As you notice, we are in the category code of S06 for intracranial injury. Our code from the index was S06.0X1. As you notice, this is a concussion with loss of consciousness of 30 minutes or less. Also take note, there's an instructional guideline to the left of this requiring a 7th character. The 7th character can be found above, dictating the specificity that this was the initial encounter of the injury. So the final code would read S06.0X1A. You would then continue on coding the diagnostic statement until you have reached all the elements covered. As you can see here, the final coding assignments would include the concussion, the traumatic headaches, the cervicalgia, and all of the external elements that would also be related to the cause of why this happened. You can see how this all ties into reimbursement, research, and planning, along with statistical analysis. Well, I want to thank you very much for watching this video. We have scratched just the surface of what medical coding is all about. Over the course of the next few weeks, we are going to go ahead and delve into more of the coding guidelines and conventions, and as they pertain to the different body systems. Coding takes lots and lots of practice. You are not an experienced coder overnight. It takes sometimes months and sometimes years to become a proficient coder. You get to learn a little bit about coding, and hopefully through this little demonstration, you got to see the process of doing basic coding and how that works. Study hard, and I look forward to seeing you in class. Thank you very much.